A warm welcome to all. First of all, I would like to thank the organizers of the 7th International Annual Conference of Egyptian Cardio-Diabetes Association and Professor Nofi Youssef for this wonderful opportunity. Let me share my slides. Coming to the topic proper, driving ahead, managing diabetes for safe and confident travels. I'll be talking under the following headings. Diabetes has become a part of modern life. As the prevalence of diabetes is increasing worldwide, a significant proportion of people with diabetes may be engaged in driving. Driving is a cognitively complex task which involves executive functioning, information processing, visual processing, and memory. This is the diagrammatic representation of the driving complex cognitive task model, where you can see the vehicle and road environment, which is assessed by the various sensory input and processed by various cognitive functions like attention, concentration, judgment, decision making, and motor function by the musculoskeletal system. And the smooth functioning of all these components are important for the smooth driving skills. Diabetes is a common metabolic disease characterized by hyperglycemia, and it is associated with both acute and chronic complications. Diabetes interfere with driving in many ways. Diabetes increase the risk of motor vehicle accident, and a meta-analysis showed 12 to 19% increased risk of motor vehicle accident in people with diabetes. History of hypoglycemia, strict glycemic control, insulin treatment, and past history of motor vehicle accident increase the future risk of motor vehicle accident. Various factors which adversely affect the driving skills in people with diabetes are all these. We will see all these factors individually. This is the previous diagram, the driving complex cognitive task model, where you can see the sensory input, cognitive function, and motor functions are adversely influenced by various factors. And coming to various factors, the first one is hypoglycemia. Hypoglycemia is a common issue in people with diabetes. It causes significant delay in reaction time, impairment of attention, hand-eye coordination, visual information processing, and mood. Cognitive dysfunction prevents the person from early correction of hypoglycemia, and it leads to serious hypoglycemic episodes. Those with hypoglycemic unawareness should withhold driving till it is reversed. Acute hypoglycemia causes significant dysfunction at cause cognitive dysfunction at blood sugar level less than 3, and it takes 40 to 90 minutes to return to the normal even after restoring normoglycemia. And people with diabetes should not drive if the blood sugar is less than 5, and the drivers should check their blood sugar before starting to drive and at every 2-hour interval. And if found low, take rapidly acting carbohydrate and check the blood sugar after 15 minutes. If it is not corrected, again take carbohydrate and check after 15 minutes. And they should not drive for the next 45 minutes after restoring normoglycemia. So hypoglycemia can affect sensory input, cognitive function, and motor function. Similarly, severe hyperglycemia can also occur during driving. Significant hyperglycemia impair cognitive, motor, and perceptual thinking, and it can cause seizure and electrolyte imbalance, leading to impaired driving skills. Various visual problems, diabetes-related visual problems include cataract, retinopathy, maculopathy, retinal hemorrhage, and retinal detachment, which can impair proper vision. In addition to that, rapid fluctuation in blood sugar can cause visual problems. Diabetic peripheral neuropathy is another common complication. People with diabetic peripheral neuropathy take longer brake response time, and people with peripheral neuropathy find it difficult to gauge the pressure on the accelerator, brake, or clutch pedals. And medication used to treat diabetic neuropathy can cause sedation and impair driving skills. Various atherosclerotic disease like macrovascular complications like coronary artery disease, cerebrovascular disease, and peripheral vascular disease also adversely affect the driving skills. Those with coronary artery disease and cardiac arrhythmia need periodical assessment and can resume driving after stabilizing the cardiac condition. Diabetes-related cerebrovascular disease, an intact neuromuscular system is required for smooth driving. And in people with cerebrovascular disease, there will be limb weakness and cognitive dysfunction, resulting in impairment of driving skills. So those with stroke are at risk of recurrent stroke or transient ischemic attack during driving. Those with diabetic foot problems like ulcers and amputation, they also interfere with the driving skills by interfering with the foot pedal manipulation. Modified vehicles with handheld control systems are available to overcome this. Sleep apnea is a major public health problem. The prevalence of sleep apnea in obese individuals with diabetes is as high as 86%. And OSA causes sleep fragmentation, leading to excessive daytime sleepiness, leading to reduced vigilance. The risk of motor vehicle accident is 2 to 7 times higher in people with sleep apnea, and treating OSA with nasal continuous positive airway pressure reduce the risk of daytime sleepiness and the risk of motor vehicle accident. Obesity increases the risk of developing lifestyle disorders, and driving itself is a sedentary activity aggravating obesity, and obese people are at increased risk of osteoarthritis. People with poorly controlled hypertension or malignant hypertension, or those who are having blood pressure more than 180/110 should not drive till the blood pressure is under control. And antihypertensive medication can also cause dizziness and tiredness. The prevalence of hearing impairment is higher in people with diabetes. Even though hearing impairment can affect driving theoretically, it does not affect the crash risk or the ability to drive vehicles safely. People with hearing impairment are usually more visually observant, drive more cautiously, and use mirrors more to compensate for hearing impairment. Medications like recent change in the treatment of diabetes can precipitate the risk of hypoglycemia, and sedative medication can also increase the risk of motor vehicle accident by impairing judgment, delaying reaction time, and increasing drowsiness. Similarly, alcohol intake and intake of other substance with the addictive potential can also impair the ability to drive. Coming to medical evaluation, any person with diabetes sent for medical fitness for driving license should be evaluated for the risk of hypoglycemia, diabetes-related complications like visual problems, neuropathy, cardiac and cerebrovascular problems, and for sleep apnea. So these are the major points in the medical evaluation, and also check the knowledge regarding the diabetes and the self-management skills. We propose a scoring system to identify drivers with diabetes at a risk of motor vehicle accident, which can be used by clinicians in their day-to-day practice. And the score varies from 0 to 38, and a score above 6 increase the risk of motor vehicle accident significantly. This is the proposed scoring system. You can see there are different domains, the treatment related questions, and there are response yes or no, and the score. Are you on insulin or secretagogues? If yes, 3 points. Are you on intensive therapy or tight glycemic control with insulin or secretagogues? If yes, 4 points. Driving related questions. Are you usually going for long distance or long duration drive? If yes, 1 point. Total score in this session. And hypoglycemia related questions. In this session, the maximum score is calculated. Any history of mild hypoglycemia in the last 6 months, 3 points. Any history of moderate or severe hypoglycemia, 8 points. Any history of recurrent episodes of moderate or severe hypoglycemia in the last 6 months, 12 points. Any history of hypoglycemia unawareness, 14 points. And any history of hypoglycemia related driving mishaps in the last 2 years, 12 points. And the next domain is self-management skill related question. No knowledge about the self-management of hypoglycemia, 2 points. Complications and comorbidity related questions. Do you have any visual problems interfering with the driving, 6 points. Sleep apnea or increased daytime sleepiness, 6 points. Sensory or motor problems in the lower limb interfering with the driving, 1 point. Cardiac or cerebrovascular problems, 2 points. Uncontrolled hypertension, 2 points. And the grand total we can calculate. And if the score is above 6, there is high risk of motor vehicle accident. Advice for the people with diabetes about driving. People with diabetes should possess enough knowledge about diabetes, the role of diet, warning symptoms of hypoglycemia, and self-management skills. Role of driving licensing authority. The driving licensing authority should be aware of the impact of diabetes on driving and take medical opinion while issuing or renewing driving license. With this background, we coined the term Rule 5, 15, 15, 45, 120 of driving for the people with diabetes, which emphasize the important recommendations for people with diabetes that they should not drive if the blood sugar is less than 5 millimole per liter, should take 15 grams of rapidly acting carbohydrate if their blood glucose level is less than 5 millimole, and or if they develop symptoms of hypoglycemia, and wait for 15 minutes and recheck the blood sugar, repeat until the hypoglycemia is corrected. They should not restart driving until 45 minutes after restoring normoglycemia, and they should check blood sugar every 120 minutes or 2 hours during long distance driving. So in some countries, there are separate guidelines for private vehicle drivers and commercial vehicle drivers. But in some other countries, there is no specific recommendation for driving. With this background, we propose a uniform requirement for people with diabetes that can be accepted and adopted universally to assure safety on our roads. So these are the recommendations. The recommendations are different for private vehicle drivers and commercial vehicle drivers. For those with diabetes controlled by diet and exercise, no need of compulsory medical examination. But those treated by glucose lowering agents other than insulin and medication without high potential for hypoglycemia, medical examination every 5 years for private vehicles, but medical examination every 5 years is compulsory for commercial vehicle drivers. Diabetes treated by insulin or medication with high potential for hypoglycemia, medical examination every 5 years for private vehicle drivers, whereas it is every 2 years compulsory for commercial vehicle drivers. Diabetes with recurrent hypoglycemic episodes For private vehicle drivers, avoid driving till blood sugar values are stabilized. But for commercial vehicle drivers, resume driving only after medical evaluation and optimization of treatment and stabilization of blood sugar value. Diabetes with hypoglycemia unawareness, the recommendation is same for both private vehicle drivers and commercial vehicle drivers. And the recommendation is to resume driving only after medical evaluation and optimization of treatment and stabilization of blood sugar values and regaining hypoglycemic awareness. So to conclude, driving has become an inevitable component of modern life. Our proposed recommendations are expected to pave the way to uniform guidelines internationally. And we published all these in the International Journal of Diabetes and Technology, where you can access the article freely. Thank you for the patient listening.